Well, I'll
Looking
tell you
forward
what,
to today's chat.
yeah, it's gonna be fun, and I think it's time to jump into the pool. So first of all, first thanks to everybody. I think everybody's in the room. We're at 54 participants, and we're pushing to 60. So let's get going. I am a superstitious man, so I'm going to start this way. I start the first five. Hello, world. Welcome back. We're glad you're here. It is currently what? Thursday at 11 a.m. Central Time. So also good morning, good afternoon, good night to wherever you are at this point. We are thrilled to be here. My name is Glenn Shore. I am a member of the local organizing committee working on the World Transplant Games 5K anyway. And I support Tricia and George and the Coffee Chat subcommittee along with Jessica Townsend. We are glad to have you here today. And I will be serving as your moderator for today's Q&A session, where we're going to be featuring transplant coordinators and transplant nurses and part of the professional community. We are glad to have you here. Just a few housekeeping notes. We've muted you all today to make sure that we have the best audio quality possible. Should you have any questions, please type them in the chat section and one of our team members will respond. So if it's a general question still about how do I register, how do I build my team, how do I log my photos, which is my favorite, how do I log my photos, we will answer that. But if you have questions directly about our speakers today, log those in as well. And I will catch them to the best of my ability later in the show. In the interest of time, that we ask our questions that, primarily that you want to ask the speakers be directed to their topics today. That way everybody gets a shot. This is a worldwide event. We are providing translation services in French, Italian, and Spanish. If you would like to take advantage of these services, click on the interpretation globe located on your control bar, and you will be directed into the appropriate room. And thank you to our translators from all over the world. Yeah, I think I've got my good friend Laura now in Venice, and I've got Vegas, and I've got everything. These guys are doing a great job, and we really appreciate it. So thank you for everything. So I'd like to make two introductions, and then they will throw it back to me. First, I'd like to introduce Tricia Fleeman. Tricia is one of our co-chairs, along with George Kovacic. Tricia's with Walgreens, and she's going to make our words of welcome today, and then she'll pass it along to Donna Esposito.
Thank you, Glenn. Well, I just want to say thank you all for, many of you have been on several of these now, and some, this is your first one, but we just really appreciate the time you guys have all put in. And I ditto to everything Glenn just said as far as all the people we want to thank, but we are super happy to have you here and very excited to hear from our speakers today. So I am going to introduce you to a very good friend of mine. I will let her tell you who she is as far as all her titles, because she is quite the busy woman, but I would like to introduce you to Donna Esposito. The floor is yours.
Thank you, Tricia, and thank you, Glenn, for all you've done for these coffee chats. My name is Donna Esposito. I've been a nurse for 36 years and 25 of those in transplant. So I am super, super excited for this coffee chat, because as long as I've been in transplant, I've never seen this kind of worldwide stage, and I am so excited to learn from all the colleagues around the world and hear what everybody has to say, and just look forward to a very informative and interactive session. So thank you all so much. Glenn?
Great, thank you, Donna. And again, thanks again to all the members of our subcommittee, but especially on this one through Donna. Donna provided great counsel. She provided great expertise. She really kept us focused, especially on this chat, all while serving, during COVID at Houston Methodist, and I believe getting your doctorate degree at the same time. So Donna, how you do it, I don't know. So congratulations to you. Over the past couple of days, we've acknowledged a lot of people. We've talked about, World Transplant Games Federation. We've talked about Harris County Houston Sports, things like that, Texas Med Center, Memorial Hermann, Houston Methodist. But there is one other group I want to recognize today, and without them, really, some of our speakers wouldn't be here, so we thank them, and that's the International Transplant Nurses Society. That is one of the professional arms of the Transplant Coordinators and Nursing Society, and we thank them for their involvement. We thank them for this participation today. So now what I'd like to do is introduce each of our speakers today, and what they're going to do is they're each going to tell their story for about 5 minutes. And then we're going to open it up to Q&A, afterwards. So, and these speakers will go in order today. First of all, I'd like to introduce Ms. Trilly Rachel Matthew from India, Ms. Dana Hong from Houston, Texas, USA, Ms. Lynn Holt from the United Kingdom, and Mr. Pristinoso from San Francisco, California, USA. And as you tell your story, maybe you can introduce what you do, which hospital you're affiliated with at the hospital, and just give a little bit of bio on yourself, and then just take a few minutes and tell us about yourself and tell us your story. So we will begin with Trilly Rachel Matthew from the nation of India.
Hi, Glenn. Thanks to Houston Sports Authority. I'm missing Jessica over here. Hi all, good morning, good afternoon, and good evening to all my other friends. So I'm from India, and India is a multicultural, ethnical, and religious and a multilingual society. We have got several cultures, and we follow various holidays and multi-cuisines. So coming to me, I work for Paras Healthcare, which is a national capital region in India. And I take care of kidney transplant over here. I've done my master's in social work. Following to that, I've done several courses and certificate courses in organ donation and transplantation, and a diploma in transplant procurement management from Spain. And in 2008, I started my career as a counselor and a transplant coordinator when the in Karnataka, there's a state in India, has brought up the policy that the social work graduate or the psychologist graduate has to be the transplant coordinator. So I got an opportunity to be trained as a transplant coordinator and work for the same. Though initially I was not very passionate, I was passionate to work in a hospital setup to help the needy and the sick people. But then once I got into it, I'm enjoying to the fullest. So now my everything is revolving around transplant donation and organ donation and transplantation. In India, we had the Human Organ Transplant Act was passed in 1994. That is to rule out the commercialism in the organ donation, as well as the law is very clear on near relatives can donate in the living donors. Relatives can donate without any hassle. Rest everything. Everybody has to go through the approval from the authority. And for the disease donation, we follow the opt-in system. And the allocation is done by the National Allocation Center, and under that we have Regional Allocation Center or the State Allocation Center. So we in certain states we have also started with driving license. When they go for the driving license or the renewal or making a driving license, they have given an option to choose for organ donation, and that will be marked as an organ donor in the driving license. But in India, unfortunately, there is no legal validity for that. It is just to express a wish that you would like to donate your organs. The ultimate decision is taken by the family members or the next of kin or whoever it is. So I've started, when I started my career in 2008, I've started as an ICU counselor and started counseling and for the disease donation, visiting ICUs every day. I've got experience in multi-organ transplant, both donation as well as in transplantation. And in living organ donation, being a transplant coordinator, I do all the activities related to the organ transplant, but to understand what is the relationship between the donor and the recipient, and to rule out the commercialization in the transplant. And in disease donor transplant, it's more of awareness on organ donation. Most of it's in-house program, as well as the public awareness. I'm an advisory member to the Organ India, who is a partner for WTG 2021. So Organ India does a massive awareness program in parts and part of the rural areas, as well as in the cities of India. After signing an MOU with the state government, So they do a lot of awareness activities, and I am also a part of it for the activity. And with related to the organ living transplant, I do a lot of coordination work. And in disease donation, what we do is that once the intensivists break the bad news and understand the viability of the organs, we start doing grief counseling. We understand the wish of the brain dead person, or else the family members. If it is so, then we ask for the organ donation. We educate them, or we do a counseling to donate organ. And if they sign the consent, then we definitely will have to put it across to the allocation center, as well as to the recipient, coordinate with the recipient center. So now coming to the story, there was a 54-year-old lady who had an ICH, brought to the hospital, declared brain dead after 48 to 72 hours. And the family was told that the patient is brain dead. And I entered into the room thinking that I should do a grief counseling to the family. The moment I entered, they started behaving to me as if I've done a big mistake with with that brain dead person. So they start yelling at me, saying that, what did you do? My mother was all right. She came walking into the hospital, and this is what you have given to me. Now she is good for nothing. So we cannot do anything. So I understood that there is something going on wrong with this thing. And so I had to arrange for a multidisciplinary team meeting, make their questions clear, make them understand about what is brain death and everything. And after that, again, I have spent a couple of hours with them. They themselves came to me saying that, oh, what is happening with our mother? What can we do next? So that is a time where I could speak to them about, this is the time that your mother can live through so many people. So they somehow caught my word that your mother's heart can be beaten in someone else's body. So that one of the daughter was like, oh, that's fantastic. So they have never heard about organ donation. So they caught up that word, and they said that, okay, but you would be selling this organ, right? So I said, no, we cannot sell this organ. But then we'll have to send, we will be informing to the allocation center, and they will take the decision. She said, give us some time. So I said, okay, you take your own time. I got back the call after a few minutes saying that we are ready to donate, but we want to see the recipient. So again, confidentiality is another issue. We cannot introduce both donor and recipient family each other. So I said, that's not possible. If you would like to donate as a noble cause, you can definitely do it, but it's not possible for us to introduce you to the donor recipient family. So then one of the family members said, when you have decided why to turn back, please go ahead with the donation. That's how they have signed. So this is a lack of awareness that what are they going to do with the organ? Will the hospital sell off my organ? Will it go to the right person, to the needy? So they do not know about this. So after that, for their rights, after the cremation, everything, I have visited their place. They were still asking me, can we see that recipient family or not? Heart recipient family. They're not bothered about the liver and kidney. They're only bothered about where is the heart. So that's one story. And second story where I had an amazing feeling is that the moment doctor has declared a 31-year-old man as a brain dead, immediately the mother came up saying that, doctor, my son is brain dead. That's what you're saying, right? He said, yes. Said, can I donate his organs? So we were all like, this was the first transplant organ donation in that hospital. And with that, we have picked up like anything. We were doing a couple of organ donation in that month. So that was quite an interesting program for us. And the third scenario, if we say, that was a 45-year-old man who was declared brain dead. Now the family is yelling at you, saying to the extent that we are not even aware that our patient is intubated, provided the consent has been signed. So the first day I met someone, they said they were giving some excuses. We were clarifying all those. So second day, that person won't come. Another person will come. The third day, the third person will come. So finally, that organ donation did not happen at all. They said, we are not the decision makers. You have to. We are not planning of giving any organ. You have made so much of bill in the hospital. So on top of it, we are not going to donate any of the organs. So these are the few challenges what we are facing um, in India. That one is a lack of family consent. Even if some of the family members give the consent, one time what happened is that we got the family consent to donate organ, but the near relatives of that person told us that, see, we have signed the consent, but we are not going to tell to his wife. So his wife should not be knowing that we have donated the organs. So we have to abandon that. So
Good. Yeah.
even if we know that the other family members are ready to donate the organ, but the wife is not ready and wife is not aware of. So in that case, we cannot take that organ. And lack of awareness on organ donation, which India is actually working on it. The Indian government is taking a lot of initiatives to work on the awareness program. They are including in the school curriculum, MBBS curriculum, and all those things. And there's a lot of superstitions and misconceptions, like if you donate one organ in this birth, you will be having a rebirth without that organ. So such superstitious belief also we will have to overcome all those things. And lack of brain death declaration is also a major problem, because it's not very clear that if declared brain death and if the family doesn't donate, what next? You cannot take out the ventilator. You cannot say that now for not donating, now we cannot take out the ventilator and your patient is, we'll have to wait till the cardiac death happens. And we have less number of organ transplant and retrieval centers. That is also a challenge, because the rural areas of India doesn't have got that much of facilities. So that only the major cities we have such facilities. So that is also a challenge which we are facing. But in spite of all this, if you see the organ donation rate from 2000 to 2019 of the global observatory data of WHO, you can see that the bar is going up, the graph is going up. But the fact is that it is not just because of the disease donation, it is because of the living donation, because the living donation number is high rather than the disease donation. We are just in 2019, we have just reached 0.92 per million population.
That's
But
great.
still we are in the rise. But 2020, we are back because of the COVID, we are again going down. 21 is also the same.
That's great.
Looks to be the same.
No, I appreciate it. And thanks for that great overview. I mean, I'm seeing, when you're seeing comments from your own professionals saying, thanks for the overview. Obviously, it's it's an interesting situation there, obviously, and we'll try to get this in Q&A, how COVID has affected oxygen supplies and stuff, and we'll talk about that in a few minutes. So what I'd like to do now is Dana from the USA, from Houston, USA. Would you like to weigh in for a few minutes?
Hi, thank you guys so much for this opportunity to meet everybody, and what a fascinating history. In the US, I think we are so blessed with the amount of outreach and knowledge that there is around. There are still issues that we have as well with awareness of organ donation, but nothing to that scope. But just to introduce myself, my name is Dana Hong. I am a transplant coordinator. I've been a coordinator for 30 years, and I have worked in kidney, I've worked with liver patients, and I have worked with most recently heart and lung transplant patients. And my history goes back. Oops, sorry, I muted myself accidentally. My history is that I started when I was very young. My sister is actually also a transplant coordinator, and introduced me when I was a kid. So I used to go to the hospital with her from the age of about 12 and round and see transplant patients. So transplant has been sort of in my blood and very fascinating to me. And that led me to this long career in transplant. I have participated in organ donation awareness, education and dialysis units, to talk about transplant and living donation. And I have also kind of spread that awareness to my family. They could probably teach you about going home after transplant just as easily as I can, because they have probably heard the information that I give very frequently. In fact, my oldest son did his Eagle Scout project as a organ donation and awareness event. And so we're a very proud family, very, very pro transplant and organ donation. And I am so happy to be a part of this wonderful community. I've met so many wonderful patients and families and have had the privilege of taking care of so many wonderful people throughout my career. And Kayla, who's here today, is one of my very special friends. She and I hit it off immediately when I was her coordinator, and then even beyond when I abandoned her and went to another organ group. So I'm just very blessed again to be a part of this. Thank you.
You're welcome. And Dana, thanks to you. And yeah, Kayla Lehman just gave you a shout out to the whole world. So I get it is well deserved. Lynn Holt, my friend from the UK, would you care to share your story? Lynn, are you there?
I've unmuted myself. Hi, good evening, everybody. Hello. Thank you for inviting me, and I'll try and follow in the previous wonderful speaker's footsteps. I could spend a long time telling you about everything to say about how I managed to get to where I got to, but I love this slide, the transplant journey, because it depicts the sunshine and the rain required for the beautiful rainbow. And for all of us dealing in working in transplantation, without the donor side, the rainy side, and then the recipients on the sunny side, we wouldn't have this amazing transplant journey. And so whenever I see a rainbow, it reminds me of the transplant journey that so many of us are on, and the recipients, the donor families, and all of us health professionals. So thanks for that. You can keep it up or you can take it down while I talk. Thank you. Okay, this one was the only other slide I was going to put up, which is basically what all of us who work in donation and the recipient side have to deal with, the joy and the grief of the transplant waiting list. And this was a long time, well, 2012, as you can see, and publicity, positive publicity and education is really the only way forward for us to try and increase our numbers of organ donors around the world, really. And this event we're having is doing a grand job of helping to do that around the world. So thank you. But thanks for showing that. This little baby did get her transplant. She needed another heart transplant, but she's still doing well many years later. So I'll just talk now. Thank you. If you want to put the screen back, thanks ever so much. I started my nursing again when I was very young, and just like Donna, really, probably about 46 years ago. But anyway, transplantation for the last 41 years. And I used to be the head nurse down in Papworth Hospital. It's near Cambridge, north of London. As we call ourselves the sister, well, I was back then, but that's the same as a head nurse. It doesn't mean I'm a nun, because Americans think sister means a nun, or so they did when I went to Stanford. They soon changed their mind, but they saw it on my name badge. They were a bit puzzled. So I started way back then. I was so lucky to come in. It's always, life is being in the right place sometimes at the right time. Certainly my career sort of worked out a bit like that. But we just started the heart transplant program in the UK, 1979. So I came in at number 3 heart transplant. And back then, we really were just muddling along. Stanford was the only place really successfully transplanting at that point. And so as you know, being there at the beginning, working with the pioneers, before cyclosporin came in. So all of the recipients who have heard of cyclosporin, I guess many of you have, this was before cyclosporin, and in heart transplantation, they would just die of a stone heart, acute rejection. But fortunately, after 1983, when cyclosporin came in, we saw obviously everything improved, and we started to do heart and lung transplants. So being involved with the first heart lung transplant in the UK was also very exciting. First Jarvik heart, the total artificial heart that came from Utah. We did that at Papworth. We were the first ones. So it was a great time to be around with all the pioneers. Very exciting, very challenging. And we learned as we went along. And I still think I'm learning now as I'm, we're always learning. It's always new developments and research, trying to improve perfusion, trying to improve maintaining the donor organs, and obviously detecting rejection in the treatment with all the different drugs that are coming through. So I'm very grateful to have been involved with all of that. I came up to Newcastle. I was asked to come and help set up the heart lung transplant program. That was about 34 years ago now, but I am now retired. So I took, well, sort of early retirement, 4 kids and a husband. I thought I want time for me. Working 70-hour weeks, many of you will recognize that. Several nights not going to bed because of on-calls. I survived it, and I left on a real high. So that's my very brief history, really, about where I got to, really. But I think that, it can be emotional and physically draining for all people working in this field. And often tears are shed, but quite often happy tears. They're not sad tears, it's happy tears as well. And I've never ceased to be amazed by the amazing gift of life. And when you go to the national games and the world games and all the events that many of us have been to, I spend my whole time wearing sunglasses because I'm always got leaky eyes, as one of my patients told me. But so I think, for our job, my job, you need a great mix of everything, clinical, organizational management, communication, and a sense of humor, obviously. So, I just think probably I'll finish with that. I know the challenges just to finish with the challenges I found was meeting the expectations of the families, because a lot of the role involved looking after the families as much as the patients, but also the transplants not proceeding, calling them in and getting them ready, and then the donor organ wasn't suitable, or the fog came down and we couldn't land the plane. All sorts of challenges come into coordinating a transplant. Finding planes was also a challenge, and obviously losing our patients on the waiting list, waiting for heart and lungs, babies and adults. So those were the challenges. But for me, being part of the journey and there to help support the families and the patients was the best bit of the job, really. And working within a team, an amazing team. I finished with, I wasn't going to have a little story, but because we started with several stories, mine is a really quick one. Baby donor, I was sending my team to retrieve, and I got a message from the donor transplant coordinator. They're called specialist nurses now in organ donation. And she asked me that the father of the baby wanted to meet my surgeon, who was flying down to bring the heart back. And that was something I'd not encountered. As with all of these things, you have to meet things for the first time and deal with it. So I went and found my surgeon, who had his own child, and said, this is going to be tough for you, but do you feel that you'll be able to meet the father when you get down there? And he just wanted to meet you. I don't know, what he wants to say, but so the surgeon met the father when he got down there, and all the father wanted to say was, please just look after my baby. And that's what the surgeon did, and retrieved the heart. So I think for all of us, it's humbling, it's emotional, it's amazing, and Yeah, it's great meeting all of you amazing people. Thank you very much.
Lynn, thank you for your story. And so last but not least, Prince Tenoso from San Francisco, California, USA. Prince, why don't you share a few thoughts with us, and then we're going to get to the Q&A.
Sure. Thank you so much, Glenn. My name is Prince Tenoso, and I am a kidney and pancreas transplant coordinator at the University of California, San Francisco, here in the US. I've been doing this for about 4 years now, but prior to this, my clinical experience is mostly with dialysis. I got into the field of dialysis because, just like many others, kidney disease has affected a lot of my family members, mostly on my mother's side. My grandparents and 2 of my uncles were on dialysis. One was fortunate enough to receive a kidney transplant several years ago. So after 11 years of working in dialysis, I decided to change the environment. And that's when I got into kidney and pancreas transplant. And like I said, I've been doing this for 4 years now. I basically evaluate patients wanting to be on the list for kidney and pancreas transplant. And I'm also in charge of evaluating international patients coming to our transplant center. I found transplant to be super fascinating and exciting because you get to learn every single day, something new every single day. In transplant, I also enjoy a lot of collaboration, not just with the other fields of medicine, but also from other transplant providers across the globe. And this is why I became a member of the International Transplant Nurses Society, or ITNS, because I get to interact with my fellow transplant nurses and discuss all these common issues that we encounter in the transplant world. And this is also how I found out about the World Transplant Games, and that's why I got invited, and I'm really grateful for that. I've been attending the coffee chats for the past few days, and I really love hearing the different stories and perspectives, and to really raise awareness about this organ shortage that we have. Here in California alone, the wait time to get a kidney would be at least 9 years if you're blood type O, and that's one of the most common blood types. For liver, for lung or heart, you have to be on the verge of death before you can get an organ offer, because you have to have that high MELD score. So I'm really grateful being invited over here. It's really awe-inspiring listening to the stories from the donors and to the recipients. And I wanted to thank Houston Sports Authority for getting this organized, and thank you so much for having me. So
Thanks, Prince. I really appreciate it. Thank you to all our speakers. So I currently have 2 pages of questions. So we will do our best. So what I'm going to do is, if it's okay, I'll identify a question and I'll identify potentially one of you to answer it. And if you feel that's outside your scope, just pass on it and we'll move forward. So Prince, I'm going to hit you with the first one, and I'm throwing a fastball, and this is coming straight from one of our readers. Does it become difficult to do the job when someone you become close to doesn't get a match in time? And how do you balance that with the aspect of your work?
It does become extra difficult because I do get close with some of these patients that I met, and you want to try to separate that. You want to have that boundary between you and the patient, because you want to try to help them as much as possible, but at the same time, there's only so much that you can do. But yes, the answer is it can be very difficult, but you want to try to be there with them to support them all throughout and let them know about other options, because just because they're not getting that offer, they can still do living donor kidney transplant. And for some people, they think that just because they don't get that organ offer or they don't get that transplant, that's the end of them. One good thing about kidney disease is that you have other options. You have dialysis, and there's different types of dialysis. It's just giving them that extra support, and sometimes it's outside of your scope. You just bringing in that human factor that you're there to support them. Yeah, that's it.
No, that's a great answer. Thanks. Sorry to hit you with the first one like so fast. So The next one I'm going to make for Lynn, because obviously, Lynn, you've had a long and established career. What has been your biggest takeaway from working with transplant patients for Lynn?
I think making the most of what they have. One of my patients told me that every day was a bonus, and I think what I learned very early is that every day is a bonus, and to grab the moment. And for the majority of the transplants I've met, they're just so happy to have another chance of living, because with heart and lungs, they die if they don't get a transplant, that, they just embrace the moment. So I think that, there are so many beautiful stories, and not every patient is as positive as, the others. Some of them have had a lot of anxiety with chronic illness, maybe, or, there's some mental health issues. And it's amazing to see some of those completely transform once they get their health back. But anxiety and mental health issues do continue for some others, and it's recognizing that and trying to support. So my baby transplant, I put in the 5 months old, and she's now 34. That's amazing. And also, I think one of my cystic fibrosis children, when he went home, his mother told me, she phoned me up to tell me the first thing he did when he got home, he was on oxygen and desperate for these lungs. Once he had the transplant, he got home and he jumped out of the car, ran in the house, grabbed the dog lead and took his dog for a walk. And when she phoned me to tell me that, that makes me think, wow, I love that. I love those sort of lovely stories. So I don't know, that's it. I could go on for hours if you really wanted more, but I won't.
Great answer. Thank you. Dana, for you, and obviously you've had a long established career in transplantation. What does encourage you to keep working with transplant patients?
Yeah, I think that we have a lot of the other speakers have kind of alluded to the fact that this is a tough job, and not everybody is cut out to work with, transplant. It's the thing that I love about it, and the thing that has kept me in it for this long is having to meet all of the patients and their families and getting to know them and caring for them over the years. While it's very hard work and it's very all-consuming, as I said, my whole family knows all about everything, because I'm talking to patients often, even in my off hours, and so it is kind of a commitment that you make, and you really have to have a heart for it. But it is really, just as Lynn just said, those stories, those encounters that we have with patients that, even if they only got 2 years from their transplant, just how appreciative they are of that, every single day that they got an extra day was a bonus day for them, and just sharing those times, those moments with those patients and their family members, and allowing them to be able to meet their, grandkids, or see a family member, get married, or, all those special milestones that we all take for granted, and just getting to share that with the patients and their family members is very special to me, and to, even the physicians. We think of them as pretty cool cucumbers, but our physicians get very attached to our patients as well, and they also get very emotional about all of these life events. And so it's a really terrific thing that we can be a part of.
Great, thanks. Trilly, you talked about kind of the state of transplantation in India and things going on there in the development. Does India traditionally have support groups for families? Is Trilly there? Trilly, your mic is off.
We don't have a support group as such for the family, but definitely that particular hospital recognizes that family and family and honors that family. Otherwise, on the organ donation day, the National Organ and Tissue Transplantation Organization, that is the central allocation body, they recognize the family. Otherwise, there is no as such support. Probably in the future we may have to build it up, not as of now, but it all depends upon India. In India here, it's a state subject. The health is a state subject. So where down in south, in Tamil Nadu, Karnataka, Hyderabad, they organize few programs, whereas in North India we are yet to start these programs, because
Right.
the donation rate is less in North India compared to South India.
Got it. I'm going to ask this question of all four of you. So we'll go Prince to Dana to Lynn to Trilly. So and I'll ask the same question of the four of you. What are some of the misconceptions you've seen people have, either about your job or about transplantation? Prince, do you want to start?
Sure. Okay.
Go ahead, Trilly. Go ahead. Go ahead, Trilly.
Do you want to go ahead, Trilly?
No, please, Prince.
Okay. There's plenty. So there's plenty. One of them is that once they get into an evaluation, they're already listed and they're going to get transplanted in a short amount of time. And, you know, when we tell them about the long wait, they get pretty upset. And that there's an organ shortage, they get, you know. So that's one of the things. Other things that I've heard is that, you know, about the organ matching. Some people have come to me and asked, well, if I have this many kids, do I get priority on the transplant list? And we explained to them, no, the organ matching is based on your wait time and with your blood type and your body size and all those kinds of stuff, but not with the number of kids. So that's one of the few things that I could recall.
Gotcha. Dana, any misconceptions that you deal with?
So for misconceptions, I think there sometimes can be misconceptions, like he said, with regard to you know, donation and time, and once somebody refers you to transplant, that you're already listed, or once you step foot in the door, definitely that you're already placed on the list. And so there is a lot of misconceptions about that evaluation process and the steps that it takes to get added to the waiting list, and you know, the time for waiting on the list. Now, Janice just put something in the chat, which is very true, which is that if someone is a living donor and then they go on to needing a kidney transplant in the future, that they do get priority on the waiting list, but you know, there is not really a priority system for that. There are, you know, all of the different organ groups have their own allocation systems, and I think they're ever evolving to try to balance out that wait time, because it is so long here in the US for a deceased donor transplant of all organ types. Other misconceptions I think that I've seen are in regard to the transplant coordinator's job. I frequently have people tell me that my job is XYZ. And so that's from colleagues as well as patients and family members that feel that you know, we don't do quite enough, but you know, it's an educational process all the way around, and it's ever evolving. We sort of stretch ourselves frequently to adapt to the needs of our patients. I think he was tossing it to you, Lynn.
Unmute yourself, Lynn.
Sorry, again, I broke my own rule. So, hey, Dana, let me just ask you a quick follow-up and then I'll throw it to Lynn. This is a follow-up. If your body rejects an organ, do you go straight to the waiting list, or do you go straight back on the waiting list? Do you go to the top of the waiting list? How does it work? You know?
So there are special exceptions. If you have a kidney transplant, for example, and unless this has changed recently, it used to be that if your organ did not function from the time of transplant, that you did go back on the waiting list at the same position that you were at when you were removed. It is not quite the same with other organ groups. And so when rejection happens, we have to determine what was the reason that rejection happened, and is this something that's going to happen again? And then listing can happen again, but it's the same process kind of starts over again. So you have to go through that evaluation, and you have to be, accepted by the team for a retransplant, because often after you've had one transplant, there can be medical or surgical complications that arise that may make it more challenging for you to get a second transplant, as well as, you may become more sensitized, and it may be much more challenging to match you with another organ because of the fact that the organ, as well as any blood products that you received, may have made you more sensitized and not as able to get a transplant as quickly as you may have in the past.
Great, thanks. Lynn, let's go back to the question about misconceptions and things that you dealt with throughout your professional career, and then I'll throw it to Trilly, because I know Trilly in her opening remarks talked about a lot of, I guess, misconceptions or lack of education or whatever, especially in India, what seems like she tends to deal with almost every day. So Lynn, I'll let you go, and then I'll ask Trilly to speak on the subject.
Misconceptions of the public is very common, because many people don't realize that although they have signed on to the register, donor register, or not opted out, whichever system is used, that the family can still veto the potential donor's wishes. So that's a big misconception, which is why we're trying to educate people to tell their families their wishes, because they think that just because they are on the donor register, the family can't veto. But in our country, in the UK, they certainly can. And I think in many other countries, they would not go against the family's wishes. So that's an enormous misconception, which is halting donation because of families not knowing the wishes. So that's one where education again comes in. We do have urgent and super urgent lists for heart and lung patients, just to touch on that, waiting for, on the list. But if you're not super urgent, you have a heart pump, an LVAD in maybe, and you can be at home, then you're not on the urgent list, so you wait a long time. So really, we prioritize on the sickest ones get done first, even if they've just been listed in the last week, and someone's been on the list a year, the sickest patient normally gets transplanted first. So I guess that it's understanding that. And even in the professional side, the donor transplant coordinators and the recipient ones teams, having an understanding of each other's roles and appreciating what's going on at both ends, appreciating maybe the recipient's side, they lose their operating theatre. So when they phone up and ask, do you think we can delay a little bit, because the heart and lungs have to sort of be taken out and then put in very quickly, and can't sit around for hours like kidneys can. Kidneys can wait the longest. So it's understanding everyone's roles. And I think in life, that's a lesson we all need to learn, that everyone's roles need to be understood, and to appreciate that everybody has their own stresses and, problems to deal with in their own hospitals. So that's my answer, Glenn.
Oh, perfect. Thank you, Lynn. Trilly, final word on the subject. Any misconceptions or issues that you deal with in education or acknowledgement? Trilly, your mic.
With regard to the education, people haven't heard about organ donation, so they do not know what is the hospital going to do with the organs they have donated. Are they going to sell it? Are they going to really give it to the needy? And how are they going to distribute? Are they going to give it to the rich people who have got money or who can afford it? What will happen to the poor? So all these things, how are they going to allocate it? So this they are not aware of. And then second education part is that they do not know what is the right time to donate, and they do not know what is brain death called. So they always mistaken brain death and coma as brain death as coma. So they think that my patient will come back. In India, there is a lot of belief with the astrology. So what they do is that once the doctor declares brain death, the patient family has a tendency to go to the astrologer or the pandit. So the astrologer gives them a list of events, what he is going to do. And they think that by giving, by praying or by giving this water or this medicine or some homeopathic medicine, some Ayurvedic medicine, the patient is going to come back. So it is difficult for them to believe that the patient is brain dead. And it is at that point of time, it is difficult for the hospital doctors or the transplant coordinators to make them understand that what you are seeing on the monitor is because of the mechanical ventilator. So that education we cannot give it at the point of brain death. So this we have to start from the school days or from the college days, so that only then we can improve the number of organ donation. And with regard to the misconception, people think that if they donate at this birth, they will be born without that organ in the next birth. So such kind of misconceptions. If I assign an organ donor card, so if I fell in with a trauma or something, will the hospital treat me properly, or will they consider me as an organ donor and just leave it on like that? So all these are the misconceptions which we have to clarify to the society.
Thank you. Well,
It's a
first of
long
all,
way to
go ahead. I'm sorry.
It's a long way to go. We have many things in India we have to do. So Organ India is working on it day and night through social media, one-to-one interaction. Now with even on the COVID time also, they are doing many activities. So that is how we are striving to get into more donations.
Understood. Thank you. And thank you for all. We could go another couple hours. I got the questions stacked up, but we have an hour of time today. So first of all, I want to thank each of you, Trilly and Dana and Lynn and Prince, not only for sharing an hour of your time today, but really just the work that you and your colleagues do in the transplant coordinator and nursing community. You know, I was talking over the last few days, and, you know, when the subcommittee set up these topics, we realized that, you know, the doctors and the surgeons are critical. Obviously, without donors and recipients, you have no need or no ability. But without the transplant care coordinators and the nurses, this doesn't happen. So we are grateful for your time. We're grateful for your commitment to your craft and your profession, and we really thank all of you. Just a couple acknowledgements. Again, I'd like to thank, obviously, the World Transplant Games Federation, Harris County Houston Sports Authority, especially the International Transplant Nurse Society today. I also really want to acknowledge the subcommittee that worked on this. You know, we've talked about them off and on the last couple of days, but, you know, the co-chairs, Tricia Fleeman and George Kovacic, Kayla Lehman, Kathleen Wood, Donna Esposito, Priscilla Sloan, Zena Berry, Eunice Eterwe, and Jessica Townsend. We thank you for your tireless time and your tireless efforts. Just a couple commercials, and then, you know, Janice, I'll ask you to say a couple of closing words. You know, obviously, if you haven't registered yet for World Transplant Games 2021, you still got a day to do so. Get your activity logged in, build your team, help us get around the world, and don't leave us hanging over the Gulf of Mexico. We need to finish. If you have any questions following up, please message WTG2021 at houstonsports.org. Also, please join us tomorrow for our last coffee chat. It will be an open forum that will start at 12 noon Central Time. It'll be our 6th of 6. So, you know, it's been a great experience so far. We want to get as many people as we can. The community's going. We want to just keep talking. We'd love to have you. Finally, Saturday, June 5th at 10 a.m. Central, so 2 hours prior to this, we will have our 5K Anyway closing celebration event, and it really proves to be an exceptional time and a great end to a great week. It's been truly, you know, just changing. So we thank you for your time. So Janice, I'll turn the mic over to you for the last moments, and then we'll say our goodbyes.
Hey, thanks everyone. I'm amazed and inspired by our coordinators. Wow, what a job you have. And I think it's important to have these kind of conversations. It's important to learn from each other. You know, different countries do it differently, but we can all learn from each other. And so that's why we wanted to create these chat sessions, no matter how many people came in to the chat, no matter what side of the issue you're on. If you're just somebody here to observe and learn, I think that we can all have takeaways. So thanks everybody, and hope to see you on Saturday. If you do have anybody that has passed away from your team between games, please send us their picture and name. We want to honor them at the celebration. And also any donor families or living donors that are part of your team that were part of the games, send us those pictures. Thanks everybody.
Right. And thanks to all. Don't forget, tomorrow, final coffee chat, an open house at noon Central, and then the closing celebration at 10 a.m. Central on Saturday. So goodbye from Baltimore, USA. We will see you all tomorrow, and thank you for your time.